Hi, it's Dr. Noel Williams, November 14th, 15th, 2020, Optimal Health Associates COVID update. So the first thing is, it's all bad. It's all bad. We can still smile, we can still be happy, but it's all bad. 4,000 cases essentially in Oklahoma yesterday, 140,000 in the U.S. We're averaging north of that every single day. The hospitals in Oklahoma are completely full, and it's going to start affecting major care events for all of us who have non-COVID events. The average wait in ERs is over 12 hours to so, some as long as 18 in major tertiary care centers. If you have something mundane, don't go to, but you need to go to an ER, don't go to one of the big ERs. Go to a smaller hospital ER that you think doesn't take care of COVID patients. That would be much more intelligent because they're overrun. Plus, you don't want to be somewhere where there's all those COVID patients. So, since it's all going down the tubes, what do we need to think about? We need to think about the fact that A, this is our next 6 to 8 weeks. B, this is the second wave. Fauci said, no, it's not. There was a wave up, a little bit of abatement, then another wave up as predicted, then a wave down, and now this one. This is the real second wave. So again, it's about nutrition. If I go into any detail, which I've done many, many, many times, it will get pulled from both YouTube and Facebook, so I can't go into detail on nutrition. But again, zinc, vitamin D, multivitamin, fish oil, melatonin. The data's there. Look back. I've documented it, and that's all I can do. If I give any details, it gets pulled because, again, for those of you who don't get it, we're in a fascist society now. I could rant and rant about anything with politics, about Trump, and it wouldn't be pulled. And whereas if I say this is what you need to do for COVID, it will get pulled. So vitamins, vitamins, vitamins. You have to take control of your own life. If you don't take control of your own life and you get COVID, I don't know what to tell you. You got to do what you have to do because the medical system isn't going to save you because the medical system's inundated with cases. So again, nutrition, vitamins, stop smoking, walk around. And so then mitigation strategies, again, which are not first-line strategies, but that's what we have to go with because everything's saturated. You wear your mask. For those of you who don't believe in wearing a mask, don't wear a mask. Don't argue with me about it. Don't text me. Don't say anything to me. I don't care what you say. You're not following the literature. It's about data. You wear your mask. If you don't want to wear a mask, again, don't wear a mask. And for those of you who don't want to wear a mask, don't wash your hands either after you go to the bathroom, okay? I mean, fine. It's fine with me. I don't care. I'm not eating for you. You're eating your own stuff. And then socially distance. If you socially distance, that helps too. So that segues into the holidays. Do you want to mix your households? Maybe. So one of my friends who's an infectious disease doctor, he's testing, they're all getting tested a few days before. If everyone's negative, anyone negative can come to the small Thanksgiving dinner of a limited number of people of I think it's 8 to 12. But every single one of them is getting tested. And it's only 2 households. So that's the key thing. 2 households, small group, no symptoms, because most of us aren't going to be able to get tested. So small group, 2 households, you're fine. And again, if it's going to be more than 6 to 8 people or 10 people, you need to get tested before you all meet. You need to not do it inside. I'm sorry. I don't know what else to tell you. COVID's everywhere. You don't want to get it because if you get it, it's statistical. If you have 100 people who get it, 20 are going to get potentially sick enough to go in the hospital, depending on age. 10% or half of that will end up in the ICU if you're over 55. So the bottom line is you don't want that to happen because there's no ICU beds and there's no ECMO machines and there's no ventilators. So that's what I want you to know. So I'm trying to be more positive. Kim, what positive notes do we have? Well, positive notes. So our team has been interacting with the governor's office all weekend. It's been just constant. Big shout out to Julie Watson at Integris, the entire leadership team at Integris, OU, Mercy, St. Anthony's, Norman. All of them are working hard, but I mean, big shout out to the Integris leadership team who's really working hard to try to come up with solutions. We're working on an emergency order to facilitate. Oh, Kim's glancing at me like I shouldn't say it. But hopefully we'll have an emergency order to speed hospital discharge so we don't have to wait for the insurance companies to give authorization, so we can get people from the hospital to a step-down unit quickly so we free up more beds. There's a lot of things behind the scenes going on like that. Now, you may question, why are we doing this now? Well, because no one else has done it, so we're having to do it, so we're getting it done. And we're working on developing some nursing home stuff with and I have to be careful, I won't say who, but with, again, Integris people with nursing homes and the state to get facilitated discharge of hospital patients who are doing well but can't go, who need some skilled care, so we can get them out of the hospital so we have more beds all the time. So we're doing lots and lots of logistical things to help patient flow, because at this point, education is not going to have much of an impact, so we have to focus on how do we make the hospitals as efficient as we can. Again, remember, good health is based on nutrition. That's what I always want you to remember. And if you're not doing nutritional stuff, I can't help you that much, because then you're going to be whimsically affected. So, Kim, any thoughts?
That makes me think of one question I saw right before you started. Somebody asked, in Oklahoma, it's certain counties or cities have the mask mandates and others don't. Two-part question: is it looking like the ones without the mask mandate are having a higher level, and if so, could that also tie into nutrition?
No. So the question is, does mask mandates in communities affect hospital admission? And the answer is yes. If we look at the admitted patients in Oklahoma, 70% of them are from communities that don't have a mask mandate, and 30% are from communities who do. So again, I'm not for mask mandates. I think you have to get people there intellectually. Plus, if you look at data, and again, I'm data driven, for those of you who think, oh, we can just mandate a mask thing. If you mandate a mask thing, the people who don't wear masks don't wear them. They're not going to. It's been shown across the country. So, and that's neither, I'm not defining it as good or bad. It's how it is. So doing it's not sensible. So it's about education, getting them to understand, and we can move more of them towards it. But it's always useless to do something that won't be useful. So, and that's what the problem with, I would say, and this is going to make everyone mad for a minute who are doctors or doctor driven. The Oklahoma State Medical Association and the Oklahoma Hospital Association, they're burning all their energy on these things for mask mandates and things. How about getting in the real world, making logistics better? But they're not doing that. So, that's just probably cost me like 400 people who are going to hate me in mainstream medicine who I have to deal with. But it's the truth. You have to focus on getting the vertical integration of the hospital systems, which seems to have been completely ignored by every mainstream umbrella association in the state. It's about that. It's not about mandates. It's not about anything. Make the logistics work. That's what we're working on. That's what our group is working on. And we're getting it done with the state, because the state cares about you. I'm sorry I've come down so obviously on the state, but now that I know these people and I see what they're doing, I'm sorry. Lance Fry, the health commissioner, he's the bomb. I mean, he's busting his butt to try to get this done. He's had 8 million meetings. He's tried and tried and tried. This guy's a winner. And these people I've met are winners. I mean, I judge people all the time, let's be honest, in terms of their intellectual capabilities and stuff. I've been impressed, much more impressed with them than many other people I've met in my life. So I think the state people are really working hard on trying to get this done. They've had some impediments, some misinformation, and some things that have just been randomly off kilter. So they're trying, we're trying, and we're going to get it done as best we can. But the number one thing is, wear your mask, take your vitamins, wash your hands, and socially distance. If you have a big party at Thanksgiving with a lot of people, if you get COVID, it's your fault. You made that choice, because you just don't know who's going to be infectious. So, good night. Take care.